The Center for Addiction and Mental Health suggests a gloomy outlook for adults living with mental health issues. More people are reporting problems, but the wait times for help are lengthy. For more, we're joined by Ontario's Minister of Health and Long-Term Care, Christine Elliott. Minister, thank you very much for joining us this morning. What is the province looking at when it comes to funding, helping mental health? I mean, you took heat because you cut $335 million from planned mental health funding in the province late last year. Where are you going now? What's the direction?
Well, actually, we are investing $3.8 billion over 10 years, $1.9 billion from the provincial government, $1.9 billion from the federal government. It's the biggest investment in mental health funding in Ontario in history. So I am excited at the prospect of being able to put those funds into the system, but of course it's also needs to be spent well. So that's what we're working on right now. We're conducting consultations across the province to understand different areas geographically, what they need, speaking with service providers, and of course people with lived experience, people who've been through the system, who know where the gaps are, who know what the most helpful treatments are, and that's where we want to make those investments.
But is that not less than what the Liberals had promised before, the plan that the Conservatives ended?
No, it's a greater investment. It's more money than has ever been put into the system.
But over a longer time period, though.
It's over a longer time period, but it is money that's going to be going into the system year after year, and we're developing a plan right now based on what people are telling us about what do we need most urgently. What I have heard from people is don't let perfect be the enemy of the good, in the sense that we know there are some areas that urgently need support and assistance as we are developing a more coordinated and comprehensive plan. So that's what we're trying to do, both things at the same time.
When can we expect to see something, see this plan come out?
I would say within the next few months. We are actively engaged in consultations. I was in London and Ottawa last week. I'm going to North Bay on Friday, so I'm actively involved in the consultations myself. I really want to hear from people directly.
And I imagine one of the big concerns was wait times. To see a specialist, anywhere from 8 weeks to a year, which can literally be life and death for some people.
It can be, and it's something that parents are very concerned about, particularly if you have a son or daughter that's expressed suicidal thoughts. You want to get them to be seen right away. But of course, the only way that you can be seen on the public system is to get into a wait list to see a psychiatrist. Not everybody needs to see a psychiatrist, so we're looking at other ways that people can be seen for lower level anxiety and depression issues, from some digital solutions to having people be seen by therapists as well, psychotherapists. So there's lots of ways that we can get people into help, so we're looking at ways that we can do that in a much faster way.
And would it be some kind of a private-public partnership somehow working along those lines?
There are organizations like the Center for Addiction and Mental Health Canadian Association for Mental Health, that provide some of those services. There are some services that one can contract that will be provided under government supervision, but there are lots of different programs out there that we're looking at just to see which are the ones that are going to be the most effective for the people needing help, as well as being most cost effective.
And the opioid crisis, it's faded a little bit from our news, but it is still a horrific concern in the city, in the province, in the country. What is being done at the provincial level? Well,
we did go through a series of consultations last summer to take a look at the overdose prevention sites as they then were, to see whether they should be continued or not. We decided, yes, they do need to be continued because they are saving lives. Many people are overdosing because they don't understand what it is that they're ingesting. They think it might be one thing, but there's lots of other additives that are put into some of these drugs, fentanyl, carfentanil, that are causing really drastic results in serious overdoses. So what we've decided to do is to continue with the centers, but we're transitioning them to consumption and treatment services with the hope that people will choose rehabilitation. It has to be personal choice, of course, but when they choose to enter rehabilitation services, we want to have the whole array of services available for them, which we don't have right now. So we know we need to continue to invest in detox beds and rehab services, those wraparound services that people need, including physical health.
Okay, Minister, thank you very much for joining us this morning. We appreciate it.
Thank you.
And we are talking about mental health.